Everyone, I'm Nidhi Dubey. I work with the strategic partnerships team at Piramal Foundation. I graduated from TIS in 2007, and since then I've worked in areas of microfinance, natural resource management, livelihoods. I entered the public health sector in 2010 while working with NACO. In these 18 years of my career, I have worked in domestic, international NGOs, government bodies, market research agencies, and now I'm working at a corporate foundation. Talking a bit about my project. The idea for the project came while working with the Niti Aayog Aspirational Districts program, where I was a part of the community engagement team and PRIs played a big role. How somehow the women who were sitting at the table were not taking decisions, they were sitting in the back end just observing. So my project will focus on the obstacles and enablers in decision-making process. And if their agency is enhanced and leadership skills are built, how can it impact the community's health and wellness? The problem statements that I started with, women's lack of participation in decision-making and the activities related to women's health are not getting prioritized. Even after 78 years of independence, we are still seeing the program get the projects from the top rather than coming from the bottom up. And it's very important that the community starts participating in their health and nutrition related work. Why this area? Again, during COVID as well, we noticed that though women were doubly burdened during the outbreak, they were not participating, they were not being heard. Hence, I thought, let's just explore this particular area. Approach, process, and outcomes. Approach, I decided the project will be in a phased manner to develop a human-centered model to address the gaps and scale up the enablers. Create it along with the community so that it's sustainable. The process is mostly internal. I had dialogue with the partnership with the program leadership team so that the project objectives can be embedded into the program strategy. I developed behavior change ready reckoners so that it can be referred to by the fellows who are in the field working with the community, and develop a checklist, which is very basic at the moment, but it is still capturing information on how many women are actually showing up for the meetings and how many of them are taking part in active planning process. Two outcomes, one of them is internal, where I really feel that it was a great achievement for me to be able to embed my program objectives into the overall program strategy. External, in some locations, I've been told that women are sitting in groups and deciding on water, health, sanitation, and nutrition activities regarding their community. Leadership journey roadmap. The 4 pillars have been an amazing, insightful, learnings have come from those 4 pillars for me. I have understood my own leadership capabilities through those assessments and discussions. For this particular project, I leveraged my network, I asked for help, and I got to work with a subject which is so close to my heart. Project growth and impact, how they are interconnected for me is I wouldn't have thought of working on this particular project if it was not to the WomenLift Health journey. And thank you for that. Engaging with male allies is something which I didn't think would play such an important role, but while working in the community, I observed that they do play a big role, even when it comes to the rural settings. Women in some locations, as I already shared, are participating. I think it's a good start to begin with. Sustaining the momentum, the fellows who have been actively working, helping me out with the project objectives, they have kind of started engaging on health, on activities around water and sanitation as well, along with health and nutrition. So I feel it's a good start. And as the program progresses, I hope we'll see more bigger outcomes at a larger scale. I would like to thank everyone who's played even the tiniest of roles in my project. But yeah, the peers at WLH team and WLH team has been amazing. This platform you guys have created, the bunch of fellows who are so inspirational. My reporting manager, Amiraj Gopalan, she has been a cheerleader through and through. Leadership team at Piramal Foundation, Coach Tulika Sinha, she has been amazing. 5 amazing sessions I've had with her, and the last one would remain with me forever. and of course, the community and the stakeholders without whom nothing is possible. They are the ones who are running the show. We are just there to act as a catalyst in the entire process. Thank you for listening me.